in the cure latency arena, I thought there was actually quite a few interesting presentations. The London patient was obviously the big piece of news, but other quite interesting studies are coming out that are presenting interesting data. Nothing works extraordinarily well, but it's definitely addressing important questions, and we're getting an insight into how new strategies might work. So there were a few presentations around the use of what's called immune checkpoint inhibitors. This is a form of immune therapy that was developed for use in cancer and is now increasingly being applied to treating different sorts of cancer. And because this immune therapy is working by boosting the immune system, it has a potential application in HIV too. And two important presentations were given at CROI. One around the use of one particular immune checkpoint inhibitor called pembrolizumab was presented. This was a study where they collected samples from HIV patients with cancer that were put on treatment with pembrolizumab, which is an antibody against a receptor called PD-1. And they reported, the study was set up to assess whether that sort of cancer therapy would also work in HIV patients, whether it's safe. And then the study that they reported on at CROI was looking at how this immune therapy might induce transcription of the virus or reverse latent virus such that the immune system can see infected cells. And what they found was actually that when you give this antibody, some of the cells that are infected with HIV start producing that virus, so they're now visible to the immune system. So that was an important piece of news because this hasn't really been investigated very well in a clinical situation before. And another study I might just add to, also on the immune therapy component, that was a study in monkeys. And they did this actually quite a big study. So they had monkeys in 5 different groups, and they were then testing 2 different antibodies against 2 different receptors, including also the combination therapy. And again, in the monkey study, they also saw that when you give antibodies against both receptors, and those receptors are called PD-1 and CTLA-4, you can actually again induce virus coming out of the cells, and they could measure that in plasma. I think it's a very important area to investigate, and whether we'll find therapies that are so effective in boosting the immune system such that it can control virus replication on its own without ART is definitely still an open question. But it's a very important area of research, and yes, I believe that it's very possible that the solution may lie in immune therapies that sort of boost anti-HIV immune surveillance to control the virus. Yeah, well, until this conference, there'd just been one case of a cure. So I think just the news that this can be replicated, this can be done again, is important to show that the concept can work. As you mentioned, it's not possible to extrapolate that treatment to patients with HIV that don't have cancer requiring a bone marrow transplant. But it's important to show that you can actually remove all HIV from the body and bring somebody into remission, which is, I guess, is the preferred term for the time being. The London patient has been off ART for now 18 months, and they haven't been able to find virus in his samples. So it's looking really good. Yeah.